Good health, and welcome to today's edition of About Health, sponsored by the African American Wellness Project. Today's program is on the Affordable Care Act, so-called Obamacare. We're going to find out what's in that act. We're going to find out what doctors think about it. Let's begin our discussion. Our special guest, Dr. Noah Aboelata, who is a family practitioner, the director of the Roots Clinic in Oakland, California. Thank you for joining us.
Thank you for having me.
You know, one of the things about the Affordable Care Act, we're also excited that people have insurance, but actually you and your Roots Clinic and your doctors have to deal with it and have to work with the patients. How are you feeling about it?
Well, for us, we're a community clinic located in East Oakland with a large population of low-income people. So for us, it's been a tremendous opportunity to get people into care for the first time. It's definitely not without challenges, though. People are coming into care sicker because many of them haven't had a doctor since even childhood. And of course, there are a lot of challenges around just the enrollment process itself.
When you talk about the population you're seeing, what's different about the Affordable Care Act that allows you to see people who previously have not had insurance? Many people think that low-income people have always had Medi-Cal or some form of insurance, but obviously that's not true.
Correct. So for women who are pregnant or had dependents who are low income as well, or blind and disabled, all had coverage under Medi-Cal previously. But now we have this population of so-called able-bodied adults without dependents. Many of them are men, and they are now eligible for coverage under the Affordable Care Act, where they previously had not been.
So the term we keep hearing about in regard to this is expanded Medicare.
Correct.
Medi-Cal. What is expanded Medi-Cal, other than the fact that it covers a different population, more people? What does expanded Medi-Cal mean?
So that's primarily what it means, is that it is expanded to cover more people. There are some provisions in the Affordable Health Care Act that are covering more preventative services. So that's the other meaning of the expansion.
Now, when you start to talk about the administrative pieces, it's still an insurance plan, right? I mean, so how are you able, is it more paperwork? Are you able to deal with it more effectively? Do you feel that in total you're able to give a better quality care than before the Affordable Care Act?
So I think primarily more people are presenting for care, which is the best part about it. So people who did not have insurance before usually wouldn't show up for care unless they were very sick, and then they would pay on a sliding scale. Roots Clinic is actually also an enrollment entity, so that means that when people come in, we can get them signed up for Medi-Cal or even through the exchange. And so that's been a huge benefit, but it is definitely an extra burden on the clinic because there is quite a bit of paperwork that we don't necessarily get compensated for doing. But it does get people enrolled, and then they're able to choose a plan, and then they're able to get covered. There have been a lot of bumps along the way. So people don't have coverage day one. They're having to wait. There's a huge backlog, and so people are still in this pending status, which gives them a lot of uncertainty still. But we're trying to ask people to just be patient and hold on. This is the most sweeping change that we've had in healthcare since Medicare was enacted. So this is major, and we feel like things will get smoothed out over time.
We're starting to hear that, at least in some parts of the state and in some parts of the country, that there's just not enough doctors to see all the new people that are coming into the system. Are you starting to feel that, and why are we so under-resourced?
Yes, we're definitely feeling that, particularly for low-income patients. So even before the Affordable Care Act, there were not enough doctors that were willing to see low-income Medicaid patients, and that's because Medicaid comes with a very, very low reimbursement. And the patients tend to have more complex issues going on because of poverty and other issues that they face. So for the most part, doctors are not very interested in seeing Medi-Cal population. And we really feel that not enough was done before the Affordable Care Act was rolled out to ensure that there would be an adequate workforce that was willing to take care of low-income patients in particular. We do hear that there's a shortage even for not low-income patients, but certainly in our communities we see that there are long wait times at some of the public clinics and the clinics that previously were mandated to take care of uninsured patients. And the number of doctors in the community that are willing to see Medi-Cal patients are now being somewhat overwhelmed, honestly, by the numbers of Medi-Cal patients that are coming in. And it does pose a little bit of a moral challenge for those doctors, because there's only a certain number of Medi-Cal patients that a practice can typically handle and still survive, because it's pretty well known that if you're going to see Medi-Cal patients, you're going to do that at a loss.
Now, when you talk about one of the unintended consequences of the Affordable Care Act is that there are basically a number of different safety nets for doctors across the country, really. I mean, the community clinics obviously have provided a tremendous safety net, but there are something called essential community providers. There are safety net providers who are not in a community clinic or who are not associated with some of the more established institutions. And some of them are feeling left out. Just kind of explore that issue with me, of the safety net that doesn't include the community clinics, and what's happening to some of these doctors and how that process might be corrected.
So I think you're speaking of a sector of the safety net that we feel is really critical. And it was critical before, but it's even more critical now after the Affordable Care Act. And that is this independent, small community providers that have cared for low-income people, sometimes for generations, that are not part of the federally qualified health center system or the county health systems. But these are, by definition, safety net providers that are incredibly important. They're culturally competent points of access to care for low-income people. And for the most part, they have been left out of some of the provisions that were put in place in the Affordable Care Act that allowed for additional resources and funding for the other sectors of the safety net. And so for us, we've actually convened a coalition of these what we call community-rooted providers who are essential community providers called Roots Alliance.
One of the things that has concerned a lot of us around the state is one of the unintended consequences of the Affordable Care Act, even though we're all very supportive and happy that people get insurance, is that some physicians who've traditionally formed a safety net outside the community clinic system have been left out. Could you discuss a little bit of that with us?
Yes, I think that there is a sector of the safety net that has traditionally provided care to low-income communities. They're often providers of color who have set up practices in their own communities and really wanted to provide the care, and have been doing so oftentimes at a loss because of their own commitment and their own mission. And unfortunately, this sector of the safety net has not really been recognized or supported. And now that we have rolled out the Affordable Care Act, this part of the safety net becomes very critical, really, to the success of the ACA, because without these points of access being really shored up and supported, we will have an even more difficult situation with access to care, particularly for low-income people. So it is important that the small independent safety net practices survive, and it's important that they that someone comes in to take their place, new physicians come in, and that really that we band together and speak with a unified voice to advocate for ourselves and on behalf of our patients.
So we're really going to have to follow that. Dr. Noah Aboelata, thank you very much.
Thank you.
We'll be right back.
What does hope look like? It's in the rising walls of a home rebuilt, raising the spirit of a community reborn. What does heart sound like? It's in the rhythm of nails pounded into wood, a beat driven by the conviction that inspiration can overcome desperation. What does home feel like? It's in the faces of Americans who built generations of memories in their home and then saw it slipping away, until friends they had never met turned out to lend a hand. For more than 30 years, Rebuilding Together has spread hope to homeowners in need, providing free home rehabilitation, making homes safer and more energy efficient. This is a place where you can turn dreams into reality. Go to rebuildingtogether.org and share the feeling of home.
When I grow up, I want to be a psychologist or a therapist.
I want to be a pediatrician.
I was hoping to become a chef someday.
I want to study law. I don't want to become a lawyer. I want to become a CIA agent.
Young people, I think, do need a mentor because
You know, we don't know everything, and you know, all the people, they've experienced stuff that we haven't.
I would like to be a baseball player.
As long as there's somebody behind you, pushing you and supporting you, then you feel that you always have the strength to keep going.
Each of our children has hopes and dreams for their future. Help them get there. Become a mentor.
All right, welcome back. Our discussion on the Affordable Care Act continues. Our special guest is Ms. Brightstar Ohlson. She is a consultant who has been intimately involved in the implementation of the Affordable Care Act. There were dire predictions when they first started. There was the website issue and the other things, but maybe to none of our surprise locally, California's done really quite well, haven't they?
Yes, everyone is really looking to California as a model. I think one of the elements that really led to the success of Affordable Care Act implementation in California was the engagement of a really broad network of trusted community partners. You know, California is so diverse and it's big, and it has the rural regions, the urban areas, and such a diversity in terms of language and ethnicity and income levels. And Cover California did a really good job at designing and engaging a really broad network of stakeholders that could play a role in making sure that everyone who was eligible could get covered.
Now, you've been very involved in the implementation process. Tell us a little bit about your company and what you've done to assist in this whole process.
So Bright Research Group, I'm the principal and CEO of Bright Research Group. We are a cutting-edge consultancy that works with public systems that are working on innovative solutions to longstanding social problems. So one of those problems is the lack of access to affordable coverage among Californians. So we have been involved since 2012, actually, in the design and implementation of the outreach, education, and enrollment assistance programs through Covered California. So we've played a role in both the design of it, and then we're actually have also been evaluating it internally and helping to provide that data on what's working and what could be improved. Now,
obviously, whenever you look at a program like this, some areas are more successful than others. I understand certain groups we were not as successful in enrolling them. What outreach efforts? What do we need to do the next time?
Well, I think that there's already really great things happening in California that we can continue to build upon. California was really, really successful at reaching subsidy eligible, meaning those consumers that were eligible for financial assistance. I believe it was somewhere in the realm of 80% of those that were enrolled were subsidy eligible.
That means that not only did they get the insurance, and not only was it at a lower cost, but there were some government subsidies to assist them.
Yes, they got some financial help for enrolling. So
was that that's in the form of what, tax incentives?
Yes, exactly, tax incentives and tax rebates.
Okay, so with those so we were very successful in California.
We were very successful at reaching the subsidy eligible. We actually, just in terms of the overall number of consumers enrolled, we had a number of different projections in terms of how many people we thought would be enrolled, and we far exceeded those. So we did a really good job in that respect. When it comes to different ethnic groups, Cover California was especially successful at enrolling Asian Americans, less successful with Latino, and moderately successful with African American.
So what happens next? You know, the next big enrollment period, first of all, we need to make it clear that people who are Medi-Cal eligible can enroll at any time, social service office, website, and we'll talk about that just a little bit. And we'll talk about it some more. But the new enrollment period starts in October for the next year. So are there strategies that are going to be different?
So I think that what we're looking at now, one of the programs that will be launched is the Navigator program, which is another form that consumers can get help if they need help to enroll. So that program is being launched right now. So consumers and Californians that didn't get to enroll the first time will be able to reach out to a Navigator entity to get help enrolling. The outreach and education components will continue. I think, you know, the first year was really about just getting people, as many people who were eligible, enrolled in either Cover California or Medi-Cal. You know, there's also the Medi-Cal expansion where, you know, adults making up to 138% of the poverty level could also enroll in Medi-Cal. So so the big push the first year was around getting people enrolled. Looking ahead, the challenge that California and all states face is around making sure that people stay enrolled, so keeping people enrolled in coverage. A lot of consumers have never had coverage before. They're not familiar with this sort of what we call, they don't have a high level of health insurance literacy. So understanding how to use health insurance, understanding how to access care, connect with their doctor, pay their premium, all those kinds of things. There's going to be a high need for support around helping consumers use their coverage and access their coverage so that they come to value it as something worth continuing to pay for.
And you've done some preliminary studies on how satisfied people are with their coverage. What are you finding?
Well, we actually haven't, we're in the process of doing some of that research here locally in Alameda County right now, and we're mid-data collection, so I can't speak to how satisfied people are with their coverage. We know that early sort of qualitative reports from the field and early research has shown that Californians are actually really, really relieved to be covered. They're feeling less stress financially because they have access to coverage, and they're feeling happy that they have affordable coverage. There's concerns, of course, and this has been covered in the media, around being able to access a doctor of their choice, long wait times, provider selection. Those are concerns that are emerging.
But by and large, I think all of the things that you're saying about the Act, that California can be a model for other states, and we've really done pretty well, haven't we?
We have. We should be proud.
All right. Well, Brightstar Ohlson, thank you very much for joining us. We'll be right back.
Thank you.
When I grow up, I want to be a psychologist or a therapist.
I want to be a pediatrician. I was hoping to become a chef someday.
I want to study law. I don't want to become a lawyer. I want to become a CIA agent.
Young people, I think, do need a mentor because, we don't know everything. And, all the people, they've experienced stuff that we haven't.
I would like to be a baseball player.
As long as there's somebody behind you, pushing you and supporting you, then you feel that you always have the strength to keep going.
Each of our children has hopes and dreams for their future. Help them get there. Become a mentor.
Before his injury, John Bennett was a career soldier. While serving in Iraq, he was shot by a sniper.
Stepped out, turned back towards the Humvee, and as soon as I did, I got hit. It shattered 2 vertebrae and fractured another one. I ended up losing my right kidney, my spleen, my colon, and half my pancreas.
Paralyzed Veterans of America got us our benefits.
I helped them fill out the forms. I hand carried the forms over to the VA and walked them through the system.
You're just trying to survive, and they help you along the way.
It's very nice to see when your work pays off and you're very successful in it, because you can see the change in that veteran.
Him starting a taxidermy business is accomplishing something every day.
I get to get up, go to a job, and do something that I enjoy. I'm glad to be back to work.
To learn more about Paralyzed Veterans of America, visit pva.org.
What does hope look like? It's in the rising walls of a home rebuilt, raising the spirit of a community reborn. What does heart sound like? It's in the rhythm of nails pounded into wood, a beat driven by the conviction that inspiration can overcome desperation. What does home feel like? It's in the faces of Americans who built generations of memories in their home and then saw it slipping away, until friends they had never met turned out to lend a hand. For more than 30 years, Rebuilding Together has spread hope to homeowners in need, providing free home rehabilitation, making homes safer and more energy efficient. This is a place where you can turn dreams into reality. Go to rebuildingtogether.org and share the feeling of home.
Welcome back to About Health, sponsored by the African American Wellness Project. And so now we're going to take some time to understand what African American Wellness Project is with its Executive Director, Mr. Kevin Nichols. Thank you for joining us.
You're welcome.
Tell us a little bit about the mission of the African American Wellness Project.
The African American Wellness Project is designed primarily to empower African Americans, whether it's taking ownership of their own health or maneuvering the healthcare system.
And is it a problem? I mean, well, what's the problem? I mean, it's kind of a rhetorical question for me, but why do we need to specifically empower African Americans?
Well, if you look at the disparities in health, African Americans tend to be over the charts as far as diabetes, hypertension, cardiac disease, etc. And many, although we represent such a small population nationwide, health-wise, we're over the charts. So the goal really is to empower us to take ownership by eating right, exercising, and just really being knowledgeable and knowing about the healthcare system as well.
Well, it sounds good. I mean, it sounds good. I mean, it's hard for me sometimes as I go through this community to believe people don't know being overweight causes diabetes, so you got to watch hypertension, or you got to. So and the people are telling them all the time. So what are we going to do differently?
Well, we're going to be places where they're at in order to reach them subliminally, hopefully, like on the radio, seeing us on television, but also in the places where they go to socialize, like concerts and festivals. Our goal really is to remind people that they may want to reconsider taking that extra bite of fried chicken or eating fried foods in general.
And don't be talking about chicken like that. But one of the bigger problems, and the bigger problems from my own perspective, is that African Americans don't get treated the same in the healthcare system. And I think one of the goals that we talked about is that we need to call that out. We need to say to African Americans at times, your health is not as good sometimes because you're not treated the same.
This is true, and I think that we take advantage of, we're taken advantage of usually when it comes to going to doctors, selecting doctors, taking a first opinion, not seeking a second opinion, and the hassle of getting an appointment and being treated differently than other patients even. So there is a problem, and our goal really is to illuminate that and really make it a non-issue, hopefully.
One of the issues we've been talking about here on this program is the Affordable Care Act. And obviously, the African American Wellness Project is involved in the Affordable Care Act. Tell us, in point of fact, what is our involvement, and specifically, what are we focused on doing?
Our goal really is to get as many African Americans involved or enrolled into the system as possible. So that means we're going to places where African Americans, with the Medi-Cal expansion, making a certain income, really people don't know that they qualify and can have free coverage. So our goal really is when people are coming to get food, like say for example at the Alameda County Food Bank, we would partner with organizations like that where we can tell people, here's your food, but also are you insured? Do you have coverage? These are the kinds of things that we would hope they would already have, but since it's clear that they don't, our goal really is to get them into the exchange.
And so we're really looking for people who are already Medi-Cal eligible, but who've just not gone down and taken that next step to get covered.
That next step, or not even knowing that this expansion exists and that they can benefit from it.
All right, so the word's been out there for a while. How are we doing it differently?
Well, like I said, we're doing it differently by, number one, we're on the radio talking about it. We have forums on the radio as well. We are partnering with organizations like the Alameda County Food Bank, the United Way, and other organizations that have a very big footprint who are actually do the next step. People can hear about it, but they also need that nudging. So we have literature that we're preparing to get out there, and also really work with Department of Human Services and things like that to be able to receive these people when it's time.
Now, people think when they have Medi-Cal they're getting a lesser insurance. What's happening? What does expanded Medi-Cal mean in terms of the quality of services that people can get?
Well, there should be no differentiation between Medi-Cal and any other insurance. It's insurance, and the doctors are still going to get paid. So another thing that we do as the African American Wellness Project is we educate doctors on how to, the new expansion rules, how to get people enrolled, and also how to maintain the same type of coverage for these individuals as well. So there should be no differentiation in coverage. It's still insurance.
What about the social spaces? So many people in the social spaces now. What is the strategy to reach those people whose primarily may sometimes daytime activity is putting on, spirited messages and seeing themselves on these very social community? What is our social community strategy?
Our social community strategy is mainly, like I said, trying to be places where people are. So if people are spending, 1 billion people are on Facebook daily. So if people are on Facebook and they're on Twitter and they're on, other social networks, Instagram, our goal really is to be where they are, encourage them to think twice about their health, do something constructive and productive for themselves, and engage with other people that are actually benefiting from this as well.
And we give other organizations the opportunity to use some of our resources to get the word out on things that they're doing. If they want to reach the African American Wellness Project, what do they do?
They go online. They visit www.aawellnessproject.org to find us there. They can also follow us on Facebook, LinkedIn, and Twitter, and any other place that they are, we are.
So if you've got a health fair or you've got an event that you're doing, any of that, then we're willing to kind of use our resources to get the word out. Mr. Kevin Nichols, the Executive Director of the African American Wellness Project, thank you for joining us.
Thank you for having me.
And thank you for joining us on this edition of About Health. Remember, health is your biggest asset. I'm Dr. Michael Lenoir. We'll talk again.